My name is Melissa Taylor, and I'm the nurse consultant for emergency preparedness with the Northeast Regional Health Office. I also serve as co-chair for the Northeast Tennessee Disaster Mental Health Committee. This committee is composed of representation from several professional groups in our region and individuals. These are including the Tennessee Department of Health, the Northeast Region and Sullivan County metro areas, Frontier Health, Mental Health Transformation Alliance, the Tennessee Federation of Fire Chaplains, Fire Services, Emergency Medical Services, the Department of Intellectual and Developmental Disabilities, Ballot Health, the American Red Cross, and a number of private mental health care providers and counselors. This committee was formed and tasked with identifying needs in our community related to mental health training and response and formulating a plan to address those needs. The greatest need identified across all community partners was the need for increased education related to the identification of mental health disorders and response. The committee researched training modalities and looked for best practices in mental health education. Mental health first aid was identified as a best practice and current gold standard for whole community mental health education. The committee then decided to select first responders, educators, and those working with or mentoring children, youth as the initial groups for this training. Through funding provided by the Northeast Tennessee Healthcare Preparedness Coalition, we recently contracted with the National Council for Behavioral Health to train 28 adult mental health first aid instructors and 9 youth mental health first aid instructors. And through donations have purchased participant manuals so that we can offer these trainings free to all first responders, educators, and those working with and serving youth in our region. The ultimate goal is to provide trainings to all community members. For first responders and educators, our goal is to enhance your education and awareness of mental health problems and crisis so that you can recognize someone in the need of assistance or intervene and take the steps needed to assist that person. This person may be a patient, it may be a student, it may be a community member, it may be a family member, it may be a coworker. Each person on the panel has contributed to this effort in some way and would like to take about 5 minutes apiece to give you their perspective on mental health first aid and the impact the training has made or could make on the population they serve. We'll then answer questions from the floor. And something that I thought was really interesting, got an email today, and we've been working with Mental Health First Aid USA and the Mental Health Transformation Alliance, and they are introducing the first Mental Health First Aid for Fire and EMS module. They already had in place a first responder module that primarily dealt with law enforcement. And through questions and requests, primarily from Northeast Tennessee, they have developed this module for fire and EMS. And the email says, fire and EMS personnel are often the first on scene to respond to a traumatic event. They are also 3 times more likely to die by suicide than they are in the line of duty. That's why it's critical they have the skills they need to support themselves and their colleagues through an emotional crisis in the immediate aftermath of an emergency. We owe it to them to help them through these crises. Mental Health First Aid USA is thrilled to announce our new module, Fire EMS, a program that provides skills for fire departments and EMS organizations across the U.S. to train their fire and EMS personnel how to interact with people experiencing a mental health or addiction crisis.